Hi, this is Team 23 reporting on managing type 2 diabetes. So in this presentation we'll go over some of the background to our project, some research into type 2 diabetes, and then how that translates into our project plan. So for an introduction, our goal here, based from the feedback from the customer, is to design a web application to manage type 2 diabetes. And our intent here is to lower glucose levels, track glucose levels, and manage those daily activities, reduce reliance on prescriptions, provide coaching, and that coaching comes in the form of diet, exercise, and medication, manage condition with less time at the doctor, reduce likelihood and severity of other drugs, and to integrate with FHIR applications so we can grab information as it becomes available. As we research the diabetes, when you look at diagnosis, you can use random blood sugar tests, fasting blood sugar tests, and oral glucose tolerance tests. Some of the warning signs that you might be getting close to diabetes is high blood sugar, your hypoglycemic index, increased ketones in your urine, low blood sugar. There's some additional ones on this page that include increased thirst, frequent urination, hunger, unintended weight loss, fatigue, blurred vision, slow healing sores, and frequent infections. So a combination of all of these things would give you a good indicator that you might be either pre-diabetic or moving into diabetes, type 1 or type 2. So if we look at research, in order to combat diabetes, there's three main areas to focus on. First is diet and exercise, so weight control, glycemic control, good nutrition, tailored exercise routines, education on the disease itself. Then there's medications you can take depending on your stage. And then there's self-care, monitoring your blood glucose levels, weight monitoring, healthy diet, and of course not smoking if you already do. So there's two main causes of type 2 diabetes. That's insufficient, that your insulin resistance in your cells, or your pancreas creates insufficient insulin. And both of those affect your glucose level. So then there's risk factors associated with that. So obesity, genetics, and inactivity are the ones that are easiest to control and big impacts. But then there's also if you're pre-diabetic, if you are getting older, if you're the wrong ethnicity, or an ethnicity that's more prone to this than others, or if your diet is high in sugars or things like that. So if we translate that into our business case in the blue, we can see how we would address each one of those. So I won't go over all of these, but most significantly is tracking this information over time, such as weight trends and diet trends, and then providing coaching, real-time coaching that allows the user to improve their health, but also to improve their risk score, which is something else that we plan to provide. And then the user can see how that risk score is increasing or decreasing over time. So then the application, when we look at the application, the user should be able to enter the glucose levels and other data into the system so they can track it. They should be able to track exercise and diet and observe and print those trends so they can take those and take them to the doctor with them. The application should use a FHIR database. It should have a menu landing page deployed through Docker, retain user data, and provide diet and exercise tracking and coaching. If we look at our project plan, we have a project lead, quality lead, developer, and document lead that's distributed among all of our team members, and then we will all be doing development for the project. And here is a more detailed view. I won't go over all of these, but it has our entrance criteria, exit criteria, descriptions, and resources of who will be doing it. And this table transforms into our Gantt chart, which shows that information over time and how we see that through the weeks we're going to be using and organizing around these deliverables. So we'll leave this in the notes for observance. And here's the references we used in our research. And that is it. So thank you.